All right. Good afternoon, Team Ivy. Welcome to week 3 of the Intersections of Diversity, Equity, and Belonging in the wake of COVID-19. This weekly Lunch and Learn series will be scheduled on each Tuesday in the month of June to build understanding of the different experiences of our students, employees, and communities during the COVID-19 pandemic and offer ways to build a better sense of belonging at Ivy Tech Community College. My name is Danisha Posey. I am the Vice President of Diversity, Equity, and Belonging here at Ivy Tech. I'm super excited about today's panel, especially with the good news that we got yesterday from the Supreme Court that has, expanded the definition of sex discrimination to include LGBTQ when it comes to employment discrimination across the country. So that's some good news for us today as we go into today's session. So today's session is about advocating for the LGBTQ community. According to the Human Rights Campaign, the lives and livelihoods of many in the LGBTQ community are at risk amidst the COVID-19 crisis. In addition to the greater risk of health complications this community may face as a result of COVID-19, LGBTQ Americans are more likely to live in poverty and lack access to adequate medical care and other basic necessities during the pandemic. Today, we're going to hear from two different experiences, two different voices. First, we have Terri Young, who is Programs Director for Brothers United, Director of Client Services and Retention at Brother United Wellness Network. She has worked in the nonprofit sector for the last 8 years, providing services to high priority populations. She holds a Master's of Science in Community Psychology. And we also have Dr. Juan Carlos Venus, who is Assistant Professor of Clinical Family Medicine in Indiana University School of Medicine, He practices primary health at Eskenazi Health Center, West Side, as well as the Eskenazi Transgender Health and Wellness Program in Indianapolis, Indiana. Quick housekeeping, you are all on mute for the duration of the session. If you have any questions for the group, please type it in the chat and I will attempt to get to as many as I can during the session. I'll be monitoring the chat, so don't wait until the end for your questions. Also, this webinar is being recorded and it will be posted on our YouTube channel for additional viewing. You can also go to our website, ivtech.edu/diversity, and you can have access to all of our previously recorded webinars there as well. All right, panelists, please introduce yourselves. Talk to us a little bit about your work and how you specifically advocate for the LGBT community within your work and personal life. We'll start with you, Terri.
Hello, my name is Terri Young, and I am the Director of Client Services and Retention at BU Wellness Network. I have been working with this agency for 8 years doing contract work, and then I came on officially full-time about 1.5 years ago. We provide prevention services for those that are not living with HIV, and then we also provide a lot of direct client care and wraparound services for those that are living with HIV. We just recently acquired an additional grant, though, that will help us to provide more services for the high-risk populations and for those that have been negatively impacted by COVID financially. We do a lot of advocacy work. We not only do we advocate ourselves as employees here, but we also have programs that train community members to be popular opinion leaders and to be advocates and to go out and to train other members of their community to be advocates for themselves and for the community.
Thank you. Where are you guys located?
We are at 3737 North Meridian Street. We're in that tall business building and we're right on the 4th floor in Suite 401.
Thank you. All right, Dr. Venus.
Hi, everyone. I'm Juan Carlos Venus, he, him pronouns. I'm a family doctor, like was said. I am from Indiana. I'm from the Crawfordsville and Lafayette area and graduated from IU, like was said. And so I've been back at IU as faculty and in my clinic role since 2017, August. And so it'll be almost 3 years, and was excited to join another physician who had started this multidisciplinary gender-affirming clinical program at Eskenazi. So there aren't very many clinics like this around the country. I mean, there are more and more sprouting up, but it's a clinic that is kind of run by the family medicine primary care specialists with some knowledge of gender affirming care, not just like hormones and surgery that people tend to think of when they think of about as transgender health services, but also just general affirming medical care and getting people to necessary services they might need, like maybe it's help in behavioral health, it's HIV risk reduction services, or helping coordinate with their HIV care provider, or maybe it's working on referring someone to speech therapy and other services that can be useful. And so we collaborate and try to partner with a lot of community organizations and be involved in advocacy work, like BU as individually as employees, but also in helping empower our patients and standing up for our patients as we can. So I do that in addition to like my kind of routine primary care clinic where I have a higher proportion of LGBT patients, or I try to recruit LGBT patients because I'm part of the community and I'm pretty excited or passionate about helping address the needs of this patient population.
Thank you. So you'll have our first question. Each week, we've been discussing how COVID-19 has affected different communities from both a health disparity and an economic disparity. Can you talk to us about how COVID-19 has affected the LGBT community in an adverse way?
Yeah, so at baseline pre-COVID, the LGBT community was disproportionately impacted in some ways by like negative economic issues. So until yesterday, like we talked about, in many places, most places, a person could get married on Sunday and fired on Monday for marrying, having had a same-sex marriage, or for announcing their transition or taking steps towards a social transition to living in a more authentic way. They could have been fired from their position. And so that's one way that there were at baseline negative economic issues going on, but also just disproportionate opportunities for education, seeking out and obtaining jobs because of lack of maybe social capital that are more prevalent in the broader community. And then you throw in the other intersections of identities, which I think it's great that that's the name of the series, because there's never just one identity that we carry. We all carry a lot with us. And my patients who are people of color, but also LGBTQ, have faced disproportionate impact too. So it can come back, all of those things have just been, for me, in my experience personally, anecdotally, working with patients, they've been magnified, much like we've seen COVID-19 magnify racial disparities when it comes to differential access and prevention for things that are diabetes or high blood pressure and things that are associated with poor outcomes from COVID-19 itself. I think this has done the same thing to highlight differences in health equity for the LGBTQ community. So personally, things like folks, disproportionately, a lot of my patients, I can't generalize, but say maybe if they work more in service industry or in other jobs that were impacted first by COVID-19, there could be a differential impact there. As well as when it comes to health, I think probably most dramatically, and something that people are talking about right now, and there's some literature coming out in the academic literature, in the medical literature, is about say the impact that COVID had on delay of care for transgender folks in accessing services that they were really, really looking forward to being able to get, that there's already a huge shortage of. I am in this unfortunate position where, there's not very many people that can do the care that I do. We try very hard to educate others, but there's still a shortage. And so now you've added in a COVID pandemic where everybody for a month was freaking out and didn't know how to do telehealth, to now figuring it out and finding a way to recover from that, where I've prescribed in this period of time probably more antidepressant medicine than I recall prescribing in the 3 months prior to it. And I've had to add in all these extra phone visits to check with people and how they're coping, getting them into therapy, which took even longer for, I think, therapists to figure out than it did take the medical providers. That may not be true across the board, but I think we're going to have some fallout from this for months to come. And it's unfortunately disproportionately impacting people who at baseline lacked social support and acceptance, who maybe didn't have the same family investment in them. And it's a very sad reality that I think it's just come out more and more because of this. One other anecdotal thing that I'll just throw out there is this whole idea of having to go, for a lot of my younger patients, having to go back into because their school was shut down or their dorms were closed, they had to go home. And I have some patients that were exceptionally struggling because they had to leave the home to be able to talk to me on the phone for their visit. And they were just so upset and distraught being at home. And some in the stages of planning their economic independence in the midst of a pandemic when they lost their job and trying to find another job. And, there's been a lot of outpouring of support from people in the community that I've relied on, sharing resources like community resources that have gone out by the indie LGBT community. I've been able to share websites and get people connected to the organizations because there was this outpouring. But unfortunately, I feel like we were at a baseline disadvantaged, and a lot of my patients were disadvantaged simply because of who they are. So that's not the most succinct answer, but I feel like there's been a lot of different ways. And so it certainly opens itself to follow-up questions that I'm happy to take, or that conversation we can have otherwise. But that's kind of my thought on that.
And as we all know, health disparities have existed for quite some time. How has COVID shifted the conversation around equity in public health, and particularly for our LGBT community of color?
Well, by increasing awareness, I think there's been a lot of things going on in the world right now that are changing the public discourse. And I think it's good. In many ways, topics that we know have been, many of us know and have been doing work to try to fight systemic racism and all of these things that are these evils that, are, in my opinion, in many ways are more toxic than some of the overt examples that, just ingrained in our daily way of life and how we've been operating, thinking, that this wasn't an issue or that the mainstream hasn't. It's definitely shifted the conversation to there actually being a conversation at a national scale. And something that several of my patients, it's been this conversation that comes up. And I try to focus it at the lens when I'm talking with a patient, like what they're doing for their own well-being and how they're taking care of themselves, because no one should have to own the issues that are going on at all. I'm sorry, if they're personally someone that's if there's someone that's personally been at a disadvantage because of a system of oppression, I don't think that they should have to own that. That's not the conversation. The conversation's what you're doing for you. But the point is, when I was going down that is we've had these conversations about what's happening, and I've seen not just in conversations with my parents or patients or what I've paid attention to happening in the lay public and what we're talking about and in the circles of LGBT people, is we're trying to draw attention to this hashtag Black Trans Lives Matter, because you could arguably say that people at the intersections of those identities are among the most disadvantaged in this country and in many settings. And I feel like that's probably not gotten the mainstream attention that it needs in this conversation, but it's starting to get there, especially over these last weeks. And I don't know if it's because of maybe popular figures and these people who have social influence in our society that's so connected, you know, like through Facebook and Instagram and all these things, getting the word out there. But I do think that other people in the LGBT community who are white and cisgender are probably questioning their own understanding. And I've had a lot of those conversations myself with my friends and people in my community. And I'm like surprised that sometimes I thought I was going to be met with like having to explain why why racism is so rampant in the LGBT community. And I'm not seeing it as much as I have in the past. And so I don't know if it's because, I mean, it's sad that so many deaths have gotten us to this point and so much unnecessary violence and continuing brutality and violence. But I don't know. That's a little bit outside of my professional, you know, hat and more on my personal hat. I've been surprised. And I think that we're having good conversations. But I think we all need to learn, you know, as white people, like how to listen more and to center those voices that unfortunately haven't been until, you know, hopefully we can now lift them up a little bit more.
Thank you. Terri, do you have anything to add?
Yes, I do. I also agree with Dr. Venus, and I will say that a few months ago when the initial reports came out that the African American community is being disproportionately impacted by COVID, there was this huge uproar and all these conspiracy theories. And it's like, if you just look at what was happening on the baseline, even prior to COVID, there were already health disparities in our community that had not been addressed. And so it shed some light on those disparities. And I think it caused people to really kind of stop and look at, okay, what is happening in the Black community and why are there all these health disparities and what are we doing to address them and what are these additional barriers? I also think it helped a lot that people were stuck at home for 2 months and they were doing nothing but watching the news and reading the paper and looking on the internet and thinking about their own lives and the people that they know in their lives. And so when we really look at how race plays into how communities are impacted by COVID, it actually makes perfect sense from a public health standpoint to say, yes, it makes sense that this community is more impacted by COVID because they were already dealing with higher incidence rates of hypertension, diabetes, and just all these other comorbidities that just compound what's happening with COVID.
So we've kind of touched a little bit about the intersections of race and sexual orientation. Terri, can you just kind of tell us, what does this even mean? Like, what does intersectionality mean in this particular context? And how does this create an equity issue?
So when we're looking at intersectionalities of race and sex, we also have to throw gender in there. And that's when it just, sometimes we, especially as providers, we forget that people are not just one thing. Like, you're not just a Black woman, you're not just a white man, you're not just a trans woman. Like, you have all these different intersectionalities, and how do they come into play when you're accessing care? So like for our trans population, or even our gender non-binary population, it's difficult for them to seek out providers that first understand what it means to be trans or to be non-binary, and then to find a provider who's also compassionate and who is not gonna misgender me. A lot of our patients, we see they fall out of care or they stop going to their medical appointments or stop seeking additional resources in care because of stigma around their gender or because of stigma around their sexuality or stigma around race. Like, stigma is this huge thing that causes problems in so many ways and in so many avenues. And so there's a lot of barriers to people seeking care and to seeking, even just with getting tested. You know, there were barriers as to where can I go in my community that doesn't require me to get on an Indigo bus and put myself in even more risk of contracting a virus because I don't have any PPE, because I don't have any money to buy it. If I got the $2 to ride the bus to go get tested, then what happens when I do test positive? Like, you know, maybe you live in a small home and you don't have the space to quarantine yourself. So there's just a lot of different things that are impacting the community. And then when we're talking about sexuality, that's also a big thing when you're talking about finding providers, again, that are compassionate and aware and educated enough to provide those services and to treat people as people that have different parts to the whole as to just, you're just this patient with this one issue.
Dr. Venus, did you want to add anything to that?
I think it was said beautifully, and
Yeah.
I think that for those of us that do this work, and though Terri and I work in different areas and in like a different role, and that I think that's something that we both feel that we can. I think a lot of the people working in this area can speak a lot to from their personal experience of working with patients who are facing all those different challenges. And so it definitely is an equity issue. It's a justice issue. It's an ethical, moral issue. I try so hard to like get people to appeal to that, because I feel like a lot of us who work in healthcare, you really want to do good by patients the best we can, but especially when for the healthcare providers, I feel like on the side of the other issue that maybe we haven't talked so much about is like lack of representation and diversity amongst the providers, right? And so I feel like, for me, or for other folks who have been on the receiving end of a lot of advantage because of our race, because I'm cis passing, because I am straight passing in a lot of ways. It depends on my gender expression changes, and the way I carry my sexuality on the outside might change depending on who I'm around. But like, I can walk through a lot of ways in my world and not have to experience what my patients experience. So if I'm never really intent on or if I never really am forced to, or have this time, like you talked about, Terri, where we're thinking about what we have and what we don't have, and maybe what we've taken for granted, and we start to listen, to the conversation that's happening. I think it gets us to question a little bit more, and so we can be better on the providing end. But I feel like it also comes back to, what are we doing as medical schools to create avenues for a diverse class of students that mirror the diversity of our population? How are we supporting our gender diverse students? How are we making it feel like a safe environment for you to wear whatever, like within, the professional conduct, like you can express yourself in a lot of ways. And this is so silly, but as a medical student, or as a resident, I had a watch, and I have like my Pride watch band, but I had like one with a white band. And an attending made a homophobic comment to me, like if I was wearing not a traditionally masculine watch, that, people were going to question me. And so it's like a microaggression or something I might have experienced. I was like, oh my gosh, I was kind of scared. And this is one small example, think about all the many examples that people have, or maybe when they look around them and they don't see anyone that looks like them, and they don't, they feel like an imposter, that they're not welcome there. So I think that's I'm talking about medical trainees. So that's kind of the other part of this equity, is that we have to think about as organizations of higher learning and what we're doing to prepare our learners or create these pipelines, because that's another part of this. I think that, and I'm talking more about solutions in the future, but it's just another part of this issue. But I echo everything that Terri said.
So as we are living in this pandemic, and as you both have mentioned, with folks losing their jobs, so much economic disparities that have already been at the forefront, we're going to be finding at the beginning of July 1 that there's going to be mass evictions of folks who aren't able to keep up with their rent during this time, and that's just as a whole. But can you talk specifically about how does homelessness and housing come into the equation for equity when we're talking about the LGBT community?
I guess I'll start with that question. Housing is a huge barrier for the LGBTQ community. For most people, if you're dealing with or you're struggling with housing security, you will likely seek out some shelter with family or friends, or maybe even a homeless shelter. But when we're looking at a lot of members of the LGBTQ community, it becomes a safety issue when we put them in homeless shelters. Unfortunately, we don't have enough shelters around the city, and then we have shelters that actively discriminate against males who appear to be too effeminate, or they discriminate against the clothing that they wear. And I've even had some clients tell me that they've been harassed and sexually assaulted in shelters. So for this community, shelters are not always the safest place for them. And there are a lot of LGBTQ youth shelters that are popping up, but those are not necessarily open and functioning right now. So what we have been able to do as an agency and working with other agencies in the city is that we've been able to provide some emergency housing for the LGBTQ population, and even for those that are at risk or considered at risk for contracting HIV. So our organization has been lucky and blessed in that aspect, is that we have some resources to provide where we can do temporary hotel stays. We can do up to 90 days of housing if you just need like rental assistance or things like that. But housing is a big deal, and especially for our trans population, there are no transgender shelters. Now there are some shelters that are more trans friendly, and so you can make a phone call and appeal to them, but then of course they have to have beds in a separate area or separate section just to keep the cisgender and transgender population segregated, so to speak. So housing becomes a huge barrier, and we, like I said, in addition to the housing resources that we also have legal resources for some of our patients and clients so that they can seek out legal representation and assistance as we move out of the stay-at-home orders and the quarantine and the pandemic starts to go away, and then they're running into all of these financial problems that haven't necessarily been, I mean, they've been a problem, but landlords have put their evictions and things on hold, but of course we know that's coming. So there are agencies like mine and others in the city that provide resources for the LGBTQ community.
That's great to be reminded of the awesome things that BU offers. And yeah, and I think that's so important. As much as I can be a cheerleader for you all or spread the word about BU, I will. I think there's, you know, BU and other organizations are kind of trying to meet this need because it exists. Personally, like on the part where I am, when I'm seeing patients getting to clinic, I hear about a lot of when people do have housing, they feel unsafe where they live, and it can cause depression symptoms, feelings of anxiety. And a lot of times my patients who are living in these areas that are less safe and they express that concern to me, they also have maybe a history of having experienced personally some kind of adversity, either, you know, somebody that they know was impacted by violence, or somebody they personally are a survivor of violence, and you know, living in an environment that maybe there's something happening that's triggering them. It ends up being an issue that impacts their health, and that's kind of when I start to hear about it. And I said what I said about it's great to be reminded of that, because I think from the healthcare provider standpoint, we need to be more collaborative with our community resources, and try to connect people with that. So the other thing I was going to say is that not just like the issues on relaxation of rules around rental, and I've heard from some landlords, you know, I don't know that this is happening uniformly, but there being some maybe like decreased, like you have to pay this much by this time, or maybe some relaxation of rental payments. What was I going to say? They have not interrupted like Medicaid coverage for patients or HIP coverage. But this is something that like pre-COVID we dealt with all the time, because maybe people who are experiencing homelessness or housing insecurity or economic insecurity, their ability to keep the same address, or they don't get a letter that they needed to get, make a power payment on their HIP or something. And it's just like so much, this is me being a little bit biased on my soapbox. I feel like it's so much bureaucracy of like, why do we have to have all these things and waste all these resources on taking away services? That you know, that annoys me. But I think that it's something we've seen relaxed, and I haven't gotten those messages from patients or been dealing with that as so much, because my patients have been able to stay covered. But what's going to happen when that relaxes? I actually don't know when the state policy is for that to relax, if it's July 1st, or if that will be extended, or what. If anyone knows, they can tell me. But we have to anticipate that being a huge issue for many of our patients who were impacted, as Terri said, by this economically and in the housing way. We did a good job, I think, about responding quickly in many ways, but now we have to deal with the long-term repercussions of this, and I'm worried about what will happen if we don't adequately think about those who are at greatest disadvantage.
Thank you. Terri, you kind of mentioned at the beginning about a program that you all have where you utilize community members to advocate for themselves and others. Can you talk a little bit about that program?
Absolutely. So as part of what we do in our prevention work, we have a program that's called DUP. It's Defend Yourself, and it is a CDC evidence-based intervention where we are training members of the community to go out into the community and to empower each other. DUP talks about everything from condom usage, STI prevention, but then it also talks about systemic racism, and it talks about prison pipelines. And so it is really one of those programs that encompasses a lot of things in a very quick amount of time, but it gives people the information and the tools they need to feel empowered. And so when people finish our program, they actually feel as if they now have more control over their lives and the systems that they're taking part of. Part of DUP also teaches people how to navigate those healthcare systems, how to navigate the legal systems, and how to stand up for yourself and advocate for yourself. We also link people with like peer-to-peer support. And so let's say you're a new person in the program and you're not as confident as someone that's already gone through the program and finished the program and is working in their community. We can link you up with a peer that can kind of hold your hand and walk you through some things, talk to you about some things, and just be a support system for you whenever you need it.
Thank you. That was good information. So Ivy Tech, I run the Office of Diversity, Equity, and Belonging. And we chose the word belonging because Ivy Tech believes it's more encompassing than just inclusion, right? We're not only including you, but you belong here. So what advice do both of you have on being the support for our students and our colleagues that they need to, in order for us to continue to build that sense of belonging for our LGBTQ students and faculty and staff? What kind of tips or advice do you have for us as an institution?
I would say just to listen and make yourself available. Your students will come and talk to you if they know that they can, and that it's a judgment-free zone. And that can be difficult for us to do as human beings because we all have our own personal biases and we all have our own personal beliefs. But when you are in that kind of position, you kind of have to check your personal biases and beliefs at the door and come there and just be available for your students. So my one thing would be to just listen and provide that judgment-free space for them, and then to become aware of some of the resources that are in the community that's available to them. And so if it's something that you can't provide, that you can always connect them with an agency or with a person that will be able to connect them to the resources that they need.
I want to echo that. There was a question that came through, and I talked a little bit about teacher learning. Sorry, that's my talk. Teacher learning. In my own personal experience, somebody had asked, how can a learner advocate for themselves in areas where there's a power dynamic and fear of consequences? So I think whatever you can do as an institution to try to promote an environment where there is judgment-free, like Terri said, and that there may be some way for learners to relay concerns about mistreatment or just experiences where they didn't feel like they belonged. And you could actually really, I think, mold your response. I think our students, what I'm finding in my job teaching medical students is that our students are like huge sources of information, and they can be very excited about being part of creating the solution. So how do we feel like our culture could positively change? What are things that we could do to promote more belonging? Yeah, those are my thoughts. I saw somebody about pets Zoom bombing, and yeah, this is Oscar. He's made appearances a lot on meetings.
I also want to commend Ivy Tech for using the word belonging. I think that that's really important that you guys took that step. Belonging is right at the baseline of Maslow's hierarchy of needs. And so we're not going to become self-actualized if we don't feel like we belong. So kudos to you guys for choosing that language.
Thank you. We got a long way to go, but we are here to do the work, and we're really excited about how things are shaping up here at Ivy Tech. So the next question we have here from the audience, HIV positive and AIDS patients have compromised immunity, even without a pandemic threat. They also probably have practiced precautions long before COVID. What additional precautions and or support do these patients need? How can we as a public provide those supports?
So that is very accurate. Our clients that are living with HIV are already immunocompromised. And so I would say as a community and as a society, taking extra precautions in your businesses, requiring all of your patrons to wear masks. I know nobody wants to wear masks. I didn't want to wear one earlier today. It messed up my pretty lipstick and my makeup. But now is the time for us to think about community as a whole and not just ourselves. And so although I may not feel sick, I could be an asymptomatic carrier of COVID. And so as a public health professional, I try to keep myself covered at all times so that I can in turn keep my patients and my clients covered. Clients or people living with HIV, they are already taking extra precautions. They are staying home a lot more frequently. They're going to fewer office visits for appointments or for doctor's office visits. But even with that, there comes an additional set of barriers because now they're dealing with even longer times of being socially isolated. And as Dr. Venus pointed out, depression is really high in the community, and it's becoming higher in the wake of the COVID pandemic because you have so many people who need to interact with other people and they're unable to, but that's what's best for their health right now. I would say that the public can support them by just wearing your mask and doing the things that you can do to keep yourself healthy, and remembering that just because you're healthy and your immune system isn't compromised doesn't mean that the next person is, and someone shouldn't have to disclose their status or disclose that they're living with HIV in order for the rest of us to take precautions to protect them.
Yeah, thank you, Terry. I was just gonna say, like I was dealing with this and reading about CDC guidelines for employers and what they should keep in mind with their employees who might have a higher risk because of an underlying condition. And the guidelines are really for them not to ask a lot of specific questions of their employees. And so I think that's important. I think that people shouldn't have to disclose their status, and that they should be able to have access and support to having those precautions in their workplace or where, and everything that Terry said spot on is what I would say. The one thing I've experienced in addition to that was that patients, I have patients who have been living with HIV for a long time and have experienced a lot of stigma because of their HIV status. And even perpetrated, I think, by healthcare providers who said, wanted them to, you equals you, this whole movement around undetectable means untransmissible. So for transmission of HIV through sex, I feel like for a long time people were kind of not told all totally factual information because there was still too much stigma and fear on the part of healthcare providers about people and their HIV status. It is something that people living with HIV have dealt with for a long time. Then you add in, if a person is living with HIV, they're taking their medication, their antiretroviral therapy, and they have a good cell count, they're not really, at greatest risk of being immunocompromised. They're still living in a lot of fear because this has been normalized, is that you need to be at fear. If you're living with HIV, you need to be in constant fear that something bad could happen. And, there's a lot that's not known about COVID-19 and HIV, and we'll know more as there's more data. to say if just being HIV positive, even if you have a good CD4 count and you're taking medicine, if that meant you were at higher risk of severe disease or not. But like the point is that now I'm talking to patients and like trying to help them have a normal life as much as they can, or be able to socially, what's appropriate while following guidelines and talking them through the anxiety that they have. So that's just like a added layer that gets to be a little bit difficult, is because even people in my personal life have dealt with a lot of fear and not wanting to see people in person, even at a distance, because of their fear, despite being healthy otherwise. So I think that's just another added layer that unfortunately is the truth. But we just have to work with folks through and find out how they're taking care of themselves, and what way we can help with their anxieties, address those concerns. I don't always have the best answers because there's still not a lot known, but there are a lot of precautions we can take, and those can be active ways of dealing with anxiety about that.
Speaking of anxiety, we had a question from the audience. Are there telephone hotlines for LGBTQ who are in emotional crisis, not only now, but just in general?
So I am aware of the suicide prevention hotline. Give me just a second, though. My counterpart says that there are specific hotlines for the LGBTQ community. She's going to pull those up, and then I will chat them in so that everybody can have that information.
Thanks to Deb, who shared the Trans Lifeline. So there's Trans Lifeline, there's Trevor Project. So Trans Lifeline is 24/7, and volunteers that staff that line are transgender themselves. Then Trevor Project, I believe, is aimed at younger members of the LGBTQ community. And if somebody's not in a crisis resource, there is one resource that's available to trans masculine people, created by trans masculine people, and it's called T-Buddy. And it's actually, it's a resource that will pair, I've given it to my patients who feel a lot like socially isolated, and some of them have acted on this, where maybe they don't know very many other trans people, but it's like a way to chat with someone or Skype with someone who is also transgender and transmasculine, specifically assigned female at birth, but identifies male of center. It's a resource that was created. And I think it was actually created by a group of young trans men of color. And they created this resource that's been hugely beneficial. They have like an Instagram handle. So it's T, like the letter T, buddy, _ is the name of that Instagram handle. And so you can share that with people. I'll put it in the box.
Thank you.
Thank you. So Ivy Tech is all across the state. We reach all corners of our state, and we have folks on this call from all over the state as well. So a question from the audience that we received was, do you see an increase in support for LGBT community in predominantly rural areas? Have we seen an increase in support there?
I'll just share quickly. I know that I don't know as much about what IYG is doing currently, but they did have an effort of trying to network across GSAs or alliance organizations at schools throughout the state. They might be a great resource to look into. I am part of a team that we do an LGBT Echo, and Echo is like we use Zoom and we do a regular clinic where we try to teach about a topic and get healthcare providers from all over the state involved. And we have some involved from Southern Indiana, from Muncie, from Lafayette, from other areas in Central Indiana. And that's been a way to get some individual folks equipped with some knowledge to provide better support. Maybe someone else could better, like Terri, if you want to speak to anything you're aware of, but I feel like in the macro, like big picture support, I don't know, I feel like we still have a lot of ways to go, but that's my inclination.
I agree. We still have some ways to go with the resources that we have in the rural community. Absolutely.
Trees is such a good resource. I forgot about Trees. There's also a health center up in North and Goshen called Mosaic Health and Healing Arts. And that's a practice that's aimed to just work with yes. So trees is great. You can get on the listserv. I met someone from trees at Ball State at an event that I went to. Ball State's a great example. So our regional campuses, and I think there's a lot of partnerships that could happen too with the state universities, and our regional campuses of Ivy Tech is thinking about ways to collaborate and cross promote programs that are happening. But that's where I met a lot. I met the person from Trees and got on their mailing list that day. And then Mosaic, it was started by a family doctor who I had went to med school with, actually, up in Goshen. And she does HIV care up there too. So that's a good resource if anyone is trying to link someone to care or PrEP, or HIV preventive services.
Thank you. I'll take a list of all those resources, and I'll add them on our website for anyone who is looking for any additional resources. Are there any other questions from our participants here? I don't want to miss out on anyone, but I think I got to all the questions. All right, well, panelists, thank you so much for your time and expertise that you've shared with our Ivy Tech community. This information has been so invaluable as we dissect the intersections of diversity, equity, and belonging in the wake of COVID. Oh, I do see a question, I'm sorry. I've heard stories of some queer folks not being allowed to have partners with them in some settings due to COVID-19 restrictions, which are being unequally enforced. What is the best way for these folks to advocate for themselves? Great question.
That is a great question. I am going to let Dr. Venus answer that one. That's actually something that I've seen happening prior to COVID, is that partners are not being allowed to go into treatment facilities or to be with their partners when their partners are hospitalized.
Yeah, there's a movement from the Human Rights Campaign, at least, with like this health equality leader designation, and Eskenazi has had to, in order to achieve that designation, had to like redo their policies about visitation and stuff like that, and non-discrimination for its employees and for patients. But I don't know as many about those anecdotal examples. I just know at Eskenazi right now, it's difficult for everyone because no one's allowed to have any visitors. That's still the blanket policy at all Eskenazi facilities. So I've had to coach families through, I take care of a lot of non-LGBT identifying people who are Spanish speaking, and I have to coach through, when you go to the ER, you're gonna be on your own. But there are interpreters there, and I have to coach them for what it's gonna be like. If they felt like this, they were not going to a place where visitors were not allowed and they were being differentially treated, I'd actually see if they could reach out. Like at Eskenazi, there's an Office of Patient Experience. If they were going to felt empowered to self-advocate, I would ask them to reach out in that avenue. I just got an email yesterday with the Supreme Court hearing, though, if people have any concerns about LGBT discrimination on the basis of being LGBT, that they reach out to Indiana Legal Services. So that would be a great resource, Tanisha, to also put on the website, because they will take referrals, and they are happy to do the work of seeing if someone, what they experienced, if there's any kind of a legal recourse. I don't know all the, and what they can do to help that person and empower that person. I think that would be a good resource. So Indiana Legal Services, and because that shouldn't be differentially applied. And if there's a suspicion that it's because of their gender identity or their sexual orientation, that, that's wrong, obviously, right? But what I gathered from the email I got yesterday was that the Supreme Court decision is going to have ramifications in other settings, not just employment, that are based on the Title VII, but I don't know about all that. That's beyond my scope of knowledge.
Yes, as a former civil rights attorney, it definitely has further ramifications, especially with fair housing and also with public accommodation discrimination.
Yeah, so that's a great news. I mean, people have been talking about it in the chat box. So I think anytime we have concern about discrimination, we can empower people with that process. Indiana Legal Services will also just help people change their name and gender markers and navigate that process, deal with a lot of other issues. And so there's just a hugely great resource.
All right, you guys have been amazing, amazing. Thank you so much. Attendees, if you would like to submit any questions, comments, concerns, feedback, please email me at diversity@ivtech.edu. We value everyone's opinions, and your feedback will be helpful as we determine our next steps in our programming. Next week, Tuesday, June 23rd, our diversity series will be discussing COVID-19 and managing mental health and other disability concerns. Uncertainty brings anxiety, sadness, and fear. This pandemic has taken a toll on all of our mental health and has certainly affected people with other disabilities. Let's talk about it. All right, thank you all. Have a great day.